5 areas will be utilized in our self-healing formula. The first area are the feet. Over 80% of low back pain has foot dysfunction which goes along with it. When the muscles, connective tissue, and joints are not working freely, other areas of the body in the knees, hips, and low back have to work extra hard to make up for that. Let's improve foot function by using the AccuBall Mini's ability to release tightness, stimulate blood flow, and open the joint motion. The next area is the pubic bone or pubic symphysis. This area in the front of the body requires the use of a heated large AccuBall. Take your AccuBall and place it on a microwave-safe plate in your microwave for 1 minute. Make sure to follow the heating directions. Place the heated AccuBall directly on your pubic bone. This area will be very tender in people who have had long-standing conditions with their low back. Move your body up or down the mat using your elbows until you find the maximum sensitivity in that area. Deep breathe, directing your breath directly into where you feel the pain. Within 30 seconds, the pain will begin to release. Stay on this spot for a full 3 minutes as it begins to shift your lumbar and sacral areas posteriorly in your body, decreasing the strain on the joint surfaces and helping to change the dynamic function of your lumbar spine. Next, we will focus on the psoas muscle in the front of your hip, which runs deep into your low back. We will use the heated AccuBall to release this area. Place it on the front and inside of your hip, on the side where you feel sciatic pain. Let your body completely relax and release. No effort is needed. 3 minutes of complete relaxation on the AccuBall will allow it to penetrate the tissue, stimulate blood flow, and release the contraction in the psoas muscle, allowing that muscle to let the low back function much more easily. Simply breathe into the area and let the weight of your body do the work. Our fourth area for self-healing of low back and sciatica are the gluteal muscles. These connect into the sacrum and low back. Use the large AccuBall to release them. Once it is heated, place it underneath the gluteal region and allow the knee on that side to fall out completely to the side, exposing the front of the hip joint. Move your body higher or lower on the mat until you locate the area of maximum tenderness, and then completely release over it for a full 3 minutes. The pain will decrease after 30 seconds, and within 2 minutes you'll actually feel the front of the hip joint migrating forward. The fifth and final area we'll work on is the actual low back itself. Now that the feet, pubic bone, psoas, and gluteal muscles have released, we can work on where we feel the pain. Use your heated large AccuBall underneath your spine, trying to locate exactly where you feel the most pain. Almost like tuning a radio station, you will eventually find the strongest signal. Relax and release when you do find it. Once it extinguishes, move to the next area of your spine where you feel the discomfort. There will usually be 2 or 3 segments that are quite painful. Remember that the first minute will be painful, but then it releases, and minute 2 to 3 is a blissful feeling when the muscles, joints open and the nervous system relaxes. You'll notice that you yourself feel very relaxed and may want to fall asleep. The joints in your spine actually will open when you lie over the AccuBall spinal line belt, making a huge difference in the mobility and function of your low back. Remember to release completely over the area. You don't have to force it, just let the weight of your body do the work for you. 2 common questions healing low back and sciatica. Number 1, how long does it take to do all 5 points? 15 to 20 minutes minimum, 1 to 3 times daily, will generate positive results. The second question, will I feel better immediately? If it's a short-term problem, you will. If it's been a long-lasting problem, expect it to take 3 or 4 days before you feel beneficial change.